This is a day where the Washington Post states it's 675,000 Americans. We have as many dead as the pandemic of 1918. Our population is bigger. It's 1 in 150 dead versus presently 1 in 500. Compare the virulency of this pandemic with what you studied of the horrific influenza of 1918.
Certainly, if you look at the viruses pound for pound, I would think that the 1918 flu virus has a higher mortality rate, just in sheer numbers, if you were to be infected. But what I think is most significant is in 1918, they didn't have modern hospitals, they didn't have critical care medicine, they didn't have antibiotics, they didn't have any knowledge of the knowledge that we have of infectious disease. In 1918, they didn't even know that influenza was caused by a virus. The virus wouldn't be isolated for about 2 decades longer. So the fact that we're approaching the sheer number of deaths now in 2020, 2021, when we have antivirals, when we have vaccines, when we have modern critical care, when we have tests, when we know so much about the biology, that's really inexcusable. We shouldn't have 1918 level pandemics. Because of all the tools we have. And I think that's the lesson, that we made this as severe as it was. That was the human factor that expanded the ability of this virus to kill.
Dr. Adalja, they did not have our social and less than social media. Were they advantaged because they did not have the messaging of the unvaccinated?
Well, they didn't have a vaccine at that time for flu anyway, but it was something that did have a lot of controversy, kind of not the same thing as social media, but there was censorship going on. Because remember, World War I was occurring, and many of the countries that were involved in the war had their press kind of unable to write about things that were considered to be unpatriotic, and the flu was considered to be unpatriotic. The reason why it's called the Spanish influenza is because Spain was not really involved in World War I, and their press was free to write about it. So I do think they had some misinformation about how bad it was, but they didn't have people that were kind of making up lies about it. There were anti-mask leagues, there were protests against masks when they occurred, but I don't think that we saw, the voice of the Dark Ages hijacking 21st century technology to spread myths and misinformation, and that's what we have in this pandemic.
Dr. Adalja, we had news crossing earlier this hour from Johnson & Johnson, which said a booster shot of their vaccine provided 100% protection against severe disease. Should we be treating a J&J booster differently than we're thinking about boosters for mRNA vaccines?
Not necessarily. What we want to see, again, is more data. This was a press release, and we knew that Johnson & Johnson was conducting a 2-dose study, because there are some people who have argued that maybe the Johnson & Johnson vaccine should be a 2-dose vaccine, just like the Pfizer, the Moderna, the AstraZeneca. And this is data showing that perhaps that is the case, that the protection, which is still very strong against severe disease that you get with 1 dose of Johnson & Johnson, can be increased by making it a 2-dose regimen. We'll have to see what the actual data shows. We'll have to see what Johnson & Johnson plans to do in terms of going to the FDA to either modify their vaccine to make it a 2-dose shot, or to say we need boosters at a certain period of time. But again, this is a debate that will play out over time with the FDA, with the CDC, ACIP committee, and actually with the data.
Another debate that has played out over time is the debate around travel restrictions for those entering the U.S. And there's a question on the timing of the U.S. announcement yesterday that those from Europe or the U.K. could come to this country if they're vaccinated, whether it was geopolitically driven or scientifically driven, given it comes at a moment when we are dealing with another surge. Do you think it was a scientifically sound decision to make this announcement now?
I do think it was scientifically sound. Travel restrictions don't keep viruses outside of borders, and we know that from the very beginning, that when there were travel bans in place, the virus was already spreading within the United States. And we have a lot of technology, not just the vaccine, but rapid tests. We know how to take care of people that come in from a different country to make sure that they don't harbor the virus with testing. And Americans are going all around the world using these tests to get into other countries. And I think this is something that is long since coming. I think that this was something that we could do with testing, with proper knowledge of people's vaccination status. So I do think that this is a good step forward, and something that I think should have been done a little bit earlier.